This is the Dollemore Daily, and I'm Jesse Dollemore. Look, I know I've talked about COVID a lot. I mean, everybody's talked about it. It's in the forefront of our minds. And I got a lot of questions. Not about treatments, not about, again, masks, not about how to prevent, not about how to curtail the surge that we're seeing across the country in specific areas. South Dakota, Texas, Florida, Mississippi, Arkansas. Got a story about Arkansas today. Reading from a CBS News article, going against FDA warnings, Arkansas physician gives anti-parasite drug to jail inmates with COVID-19. One of the most perplexing incidences surrounding COVID is how this pandemic has been politicized by the right, not the left, not by Democrats. And these fringe cures, these miracle drugs, whether it be hydroxychloroquine or bleach and light being shot into the maybe up your ass. Who knows what Donald Trump thought in that case. But there's a new one. There's a fringe character on Twitter. His name is Brett Weinstein. He's part of the intellectual dark web. And he's been promoting ivermectin, this drug, this anti-parasite, not even antiviral drug, as a miracle cure. It's dangerous. It's harming people. Because you get idiots, even doctors, in this case, a physician, who it seems almost like an experiment. They're experimenting on prisoners. We got a great history of that in the United States. Let's just keep doing more of that. A detention center in Washington County, Arkansas, has been using the anti-parasite drug ivermectin to treat inmates who have COVID-19, local officials say. Even though when you're a doctor, your job is to do no harm. It's to follow the guidelines of both the Food and Drug Administration and the Centers for Disease Control, the National Institute of Health. We have a wide infrastructure of organizations and agencies within the United States to give guidance and direction to physicians that they not hurt their patients. Even though, again, the U.S. Food and Drug Administration has specifically warned against it. The FDA says the drug, which is frequently used as a dewormer in animals, is not an approved or recommended treatment for COVID-19 and can cause serious harm. But what do they care in Arkansas? It's a prisoner. Am I right? Just experiment on them. They're in jail. If they didn't want to get experimental treatments, they shouldn't have done the crime. Is that what we're saying now, Arkansas? Eva Madison, a county elected official, raised the issue during a Finance and Budget Committee meeting Tuesday night. Jail officials were representing the 2022 budget, which included the jail's physician, Dr. Rob Karras, asking for a 10% increase in the medical services contract. Madison informed committee members and the jail officials that a county employee who has opted to stay anonymous to the public told her that he had been sent to the jail's clinic to get tested for COVID-19. When the person tested negative, they were given a $76 prescription for ivermectin. He was concerned about the prescription and asked his primary care physician about it. And the physician told him to throw that in the trash, Madison said. The FDA has warned against using ivermectin to treat or prevent COVID-19 in humans, but misinformation and unsubstantiated claims touting the drug have spread widely on social media. The agency said it has received multiple reports, not a one-off. This is happening all over the country, where idiots are taking farm animal medicine. The agency said it has received multiple reports of people whose use of the drug required them to seek medical support or hospitalization. Quote, ivermectin tablets are approved at very specific doses for some parasitic worms, and there are topical formulations for head lice and skin conditions like rosacea, the FDA says. Ivermectin is not an antiviral drug. Ivermectin is not antiviral. The coronavirus, it's right in the name, Arkansas physician, Dr. Karras. It's not antiviral. So what are they doing? They're experimenting on prisoners. Good to go, Arkansas. What's next? What's next? Anyway, this is there is a rift that has been created in our society in America between two political parties, and it is being fomented, just like the insurrection was, by Republicans. This is not being done or encouraged by Democrats, who, in this case, are, and in most cases, are absolutely dedicated to what the science says. The stats and the data and the voluminous research by pandemic researchers like Tony Fauci and others of what treatments work and what don't. It's why we've waited for now the Pfizer vaccine to become fully authorized, no longer an emergency use situation. That's why Moderna is likely to be in about a month or so. We're going to see that because they work. And those are the treatments we should be promoting. Not ivermectin, not hydroxychloroquine, not these other fringe treatments, not drinking a cap full of bleach, Donald Trump. And it is in Republican states where they are failing their populace. They are failing their constituencies. Florida, more deaths right now than at any point during any of the other surges. Ron DeSantis, killing the very people he needs to remain in power. And there's no end in sight. Greg Abbott doing the same bullshit in Texas. He refusing to mandate vaccine, even though it is now fully authorized by the Food and Drug Administration. Absolutely disgusting. Anyway, I'd love to know what you think. Am I wrong? Am I right? You can call, leave me a brief voicemail, 714-576-4054. Of course, you can email me daily at dollemore.com. I'd love to hear from you. I'd also love to have you connect with me on social media, mix it up with me there. And I would ask that you support my work. If I bring you value, if I don't, go support somebody else. But if I bring you a little bit of value every day, consider supporting my work. You can click the join button, become a channel member for $2 a month. You can go over to patreon.com/IDoubtItPodcast. There are varied ways that you can help support my work. And if you're not in a financial position to do so, don't worry. My content will always be free. But tell a friend. Forward my video on your social media platform or text the video, or you do whatever you do. Anyway, I love you guys. I'll see you next time. Until I do, be genuine. Take care of one another.